Welcome to Living Healthy Chicago. Today we're kicking things off by finding out why it's important to know your family health history. And these sisters are hoping their experience with ovarian cancer will inspire you to learn about your own background. For Renee Zemovich, her experience with ovarian cancer began with a routine visit to her doctor.
Didn't really have any symptoms. I felt like something was pulling on my right side, but it was nothing that I thought I needed to go to see a doctor about.
Concerned, Renee's doctor sent her for a pelvic ultrasound.
The very next day they called me and they said there was something wrong. I was told that I had a 9-centimeter mass.
The diagnosis was ovarian cancer.
Ovarian cancer is a malignancy develops either the ovaries, the fallopian tubes, or the peritoneal cavity. It can spread to other locations. And so the problem with ovarian cancer is there's a lot of vague symptoms. Some of those symptoms can be abdominal pain, pelvic pain, bloating, feeling like your clothes feel a little tight, or urinary urgency or frequency. And then sometimes they don't have any symptoms at all. The average age of diagnosis is 61.
You're scared, you're nervous. Never once would think I had something growing in me. I go to the gym, I eat right, I stopped smoking, I did everything that you're supposed to do. And here I'm the one that had the cancer.
There's not a good screening test. You know, there's not a mammogram of the ovaries that patients can get on a routine basis. Most of the time it's diagnosed at an advanced stage. Time is of the essence. It's imperative that we make a clinical decision very quickly, we analyze the data very quickly, and if patients are indicated for surgery, we take them to surgery, immediately for an exploration.
Renee's cancer was at stage 2. She had surgery to remove her ovaries and had a hysterectomy, followed by chemotherapy. But as much as Renee was concerned about her own health, she also became worried about her sister, Regina.
We're identical twins. It was like a red flag saying, hey, she could have this too. It worried me a lot. I kind of stepped back and thought to myself, well, if she had ovarian cancer, does that mean I'm going to get ovarian cancer?
Dr. Lowe and Regina decided she would undergo a risk-reducing procedure to decrease her chances of developing the same cancer her sister had.
Take the tubes and ovaries out, which is a preventative surgical procedure to reduce the risk of developing ovarian cancers for BRCA carriers.
Regina had her ovaries removed, and then the doctors discovered she could have very easily followed the same path as Renee.
I found a pre-cancer lesion in her fallopian tube. She's got a precursor that, typically develops into ovarian cancer. She would have developed ovarian cancer at some point in time.
Was I due to get ovarian cancer a couple months later? I believe I was. Do I believe my sister saved my life? Sure I do.
Both Regina and Renee also underwent genetic testing and discovered they had a BRCA2 mutation.
BRCA1 and BRCA2 gene mutations, they account for about 75% of all hereditary ovarian cancer. If you have a genetic mutation, like a BRCA1 or BRCA2 mutation, your identical twin's gonna have it.
Once both of them finished treatment, the sisters were determined to make some changes and live healthier lives.
I actually love making my carrot juice and all the combinations. I use turmeric and ginger and all that stuff that's really good for you.
Because of my sister, I do watch my food intake. I stay away from the sugars, just like she does.
They both say that their dietary changes, combined with close monitoring by Dr. Lowe, has helped them stay healthy.
We're actually feeling really pretty good at this point. Try to do stress-free, try to eat right. It's a different lifestyle now.
You got to kind of change your diet, but it's for the better. I think we'll do better in the long run. We take one day at a time.
They're both doing great. No sign of disease for either one of them.
The sisters hope their story will encourage others to ask questions about their own family health histories and explore genetic testing with their doctors.
It's all about your family history. You got to get that family history, and if you know you have cancer in that family history, well, you got to step up and do something about it.
Get that genetic marker done. I mean, that gave us a heads up on, okay, we need to be watched.
Don't take things for granted, Get yourself checked, because you want to catch it at an early stage. That's the whole key,
You want to get it done as fast as you can.